And I just want to also say hello to our Facebook friends now joining. This presentation that we're going to be doing right now is going to go for about 15 or 20 minutes. It's a pretty quick one. The topic is new patient processing and how to maximize reimbursement. And we are also broadcasting this webinar through our webinar platform. And those of you that have joined through our webinar platform, you could see all the slides scrolling across your screen. So we're going to get started. There's no audio taping or video taping allowed, and any unauthorized reproduction, dispensing, or forwarding of this presentation is illegal. The information in this presentation is not intended to substitute your thorough clinical decision making. I've made every attempt to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. For those of you that do not know me, hello everyone on Facebook. I am a chiropractor. I practiced for many years, and I am also a certified professional compliance officer. I am a certified billing and coding specialist. After I practiced for about 16 years, I decided I wanted to do some consulting, so I started doing that part-time, and that led to full-time, and now I've been running target coding for about 12 years. And just to, share a few things, I'm not the insurance guy. A lot of people think, oh, you're the insurance guy. It doesn't matter to us here at Target Coding if you're an insurance practice or an all-cash practice. We just want to make sure you're complying with all the federal and state laws. What we do, basically, is we help doctors maximize reimbursement through proper billing, coding, documentation. We also implement Hipaa compliance plans and Medicare compliance plans. Basically, we want to make sure you're not leaving any money on the table and you're complying with all federal and state laws. It doesn't matter if you're an insurance practice or a cash practice. All right, so let's start off with the new patient telephone call. So you should see that on your screen, Target Coding members. You're going to get all these slides that you see going across your screen right now. So brand new patient calls, what do? That's what we want to do today. We want to talk about how to maximize reimbursement on that brand new patient visit. But let's start off with the phone call. Patient calls to make an appointment. How do you train your staff members, doctors? What do you tell your staff members to do? You need to have a formal training on this. You want to make sure that they're all on the same page. You want to make sure everybody is, saying the same message. So do you want your staff members to be asking for insurance information on the very first phone call? Most doctors do it. A lot of patients, they will just disclose, I have insurance, will you accept it? So now I know some doctors that they don't want to talk about insurance on the very first phone call. They don't want their staff to discuss money on the very first phone call. That's up to you, but you want to gather as much information as possible. You want to get their name, their email, chief complaint, maybe, who referred the patient, insurance company name, if insurance gets brought up, and that's what you want to do. Now there's you see on your screen, there's our Target Coding sample new patient phone call intake form. This is something that, we give our clients to just remind, especially brand new CAs, just follow this little order. What's your chief complaint? Have you seen anyone else for the condition? If the patient has seen another provider for the condition, there's a chance you might be able to bill a higher level code. It's called a consultation code. Were you involved in any type of accident, on-the-job injury, automobile accident? So there's a whole bunch of questions. And then we have a script here. Hello, Dr. Smith's office, Katie speaking. Can I help you? Yes, I'd like to make an appointment. So, staff members, they have to know, is this a new patient or is this an existing patient? If you have a staff member just starting out and somebody says, hi, I'd like to make an appointment, how does your staff member know it's a new patient or an existing patient? I'll give you the answer. Train your staff member to say, when was the last time you saw the doctor? Patient says, I've never been there before. Bing, a bell should go off. No problem. When would you like to come in? And then here we have our script. You could follow our script here on the screen. Give them choices. Lead patients through this new patient phone call. Give them choices. Otherwise, they could distract you and cause you to be on the phone too long. You want to be nice. You want to give a good first impression. You want to give the patient that impression that all they do is the patient is their main focus. I've had some of my clients had said to me, Dr. Kotler, can you call my office and be a secret shopper, make believe you're a patient? Tell me what my staff says and what you think, how you think they're doing. Most of the time it works out, but sometimes I've called and said, hi, my name is Marty, I'd like to make an appointment. Staff person says, hold on, and I'm on hold for 10 minutes. Not a good first impression. I've called some CAs where they go, and I would say, how much do you charge? And the staff member goes, oh, we don't charge, come on in. Could I make an appointment? No, we don't take appointments, just come on in. I tell this information to the doctor, and the doctor is flabbergasted. He says, no, I didn't teach my staff how to do that. So you see on your screen, that's great. What seems to be your main problem? Again, that's a little tricky. You may not want to ask patients what seems to be your main problem, because it could lead into a longer phone call that's not necessary. So your staff have to be really trained. Now, sometimes there's patients shopping around. Have you ever had a patient say, is the doctor good? Or you could tell the patient shopping around. So hopefully your staff member knows how to sell the sizzle, right? Dr. Smith has treated, here, take a look at your screen. Dr. Smith has treated thousands of patients with low back pain over the last 8 years, gets tremendous results. He's an outstanding, very knowledgeable chiropractor. So now at the end of the phone call, in this particular scenario you see on the screen right now, this patient is ready to hang up and not talk about money. So, doctor, staff, how do you want to handle this? You want to talk about it right on the phone, or do you want to wait for the patient to come in? In general, I tell my clients, don't beat around the bush, find out. So here, the patient, you see on your screen, the patient is ready to hang up. I instruct the staff member here, the CA's name is Katie. She says, well, Tom, okay, you're all set. Now, if you have insurance, please bring your card with you. Will you be using insurance? Ask the patient. Not everybody wants to use insurance. And now, here's where it can get a little tricky. This is where you could lose the patient. This is the most important part of the phone call when it comes down to money. Patient says, yes. Do you accept ABC insurance? Yes, we do. Great. How much is it going to cost? Well, there are many different plans. I like giving a range. You see, the fee range is $50 to $150. If you're in network, you might be able to say, oh, yes, we're in network with that plan. It's a $35 copay. Makes it simple. If you're out of network, you might have to say, well, you have insurance, right? Yes. Well, you may only be responsible for a small portion. When you come in, we'll call your insurance company and find out what the coverage is. All right, and then we have a whole bunch of other key points. Are you in network, out of network? I don't like giving an exact fee. If a patient says how much, some of you might say, well, we don't give prices over the phone. I think it's a good idea to give a range and not get locked into one particular dollar amount, because sometimes some patients takes longer. Then we have the initial visit. Get the forms out of the way. See all the forms you see there on your screen? These are the most important forms, in my opinion, that you should be having the patient fill out. Health history form, have good quality forms, assignment of benefits. You see a PI patient, a letter of protection, or a lien. Good luck trying to get an attorney to sign it. Consent to treat minor, acknowledgement form for non-payable services, outcome measurement forms, authorization to release information, assignment of benefits. Hold on. Are you a cash practice? Yes? You're a cash practice. So that means the patient is paying you at the time of service. Yes? Okay. Don't have the patient sign any assignment of benefits forms. That would be, contradictory. You're a cash practice. So you want the patient to pay you, and you want the checks to go to the patient. So don't have the patient sign assignment of benefits. Here's a couple of forms you see on your screen. Get nice, clean, easy to read forms. I know patients don't love filling out forms, but you have to gather this information. Maybe you want to get it electronically. Here's our Hipaa form. Those of you listening to this presentation on our web platform and through Facebook, we have a Hipaa notice form, the Notice of Privacy Practices. We usually give that to clients. Today, watching this presentation, just send an email to us, and we'll send you our Hipaa notice. That's that form that the patient has to fill out on the very first visit, also known as the Notice of Privacy Practices. How old is yours? Most of the time, when I look at a doctor's Hipaa notice, they haven't read it, staff hasn't read it, Patients are signing forms, and some of them don't even make sense. Some of them are old, outdated. I was looking at one doctor's form. I see all this dental information in it. I went, Doc, have you read this form? No. Staff read the form? No. Where'd you get the form? My brother-in-law, he's a dentist. Oh yeah, I can tell, because all this dental information was in his notice of privacy practices. Hey, listen, if the patient doesn't want to read it, that's fine, but you need to know what's in there. You ever rent a car? You see that 12-page agreement they give you? Do you read it? I mean, I don't. I'm guilty, yes, guilty as charged. When I rent a car, I just sign the bottom of the form. I don't read the form. I guarantee you, Avis has read that form. Their attorneys have read the form. I just sign it. If you give your patients a form, most of them will just sign it, but make sure you know what's in there. So I would recommend you get a good quality HIPAA notice. If you want ours, just contact us, and we'll get it to you. Here it is on your screen. Got to make sure the patient signs it. You don't have to give them a copy. How about, as far as new patient processing, insurance verification? It's changed over time. Insurance verification has changed. Many times you can get it online or through other means, but if you're going to call insurance companies to verify coverage, part of new patient processing, right? That's what we call it here, new patient processing. There are 5 things right there. You see them: E&M, testing, modalities and procedures, adjustments, and miscellaneous like back braces and orthotics and home traction devices, acupuncture, lab work. These are the main questions. Next slide. There, you see, this is our form. It's very comprehensive. Some of the things on this form you might want to just get rid of. This is our insurance verification form. Office managers, insurance verification staff, make sure you have a good quality form and you're confirming all the coverage. There are certain key questions you'll see on my form that you should be asking that could help you get paid for more visits. That's what we want to do here. We want to maximize insurance reimbursement. You want to get paid for everything you do. That's all we want to do here at Target Coding, is get our clients paid for the services they're providing in a compliant manner. Now, here's where it gets a little tricky with staff. When patients are coming in for wellness care versus medical necessity, educating patients on fees, keep fees simple. Fee confusion is one of the most common reasons for complaints to state boards. All patients should be aware of your normal fees, right? Tell patients your normal fees. Now, if you're going to provide a discount, tell them you're discounting off your normal fees. See, if you don't tell your patients your normal fees and you're just discounting them, and then they come in and have insurance and now you're billing the insurance their regular fees, this could cause sticker shock. Patients can get upset. When I was coming in as a cash patient, this is how it goes. When I was coming in, Dr. Smith, as a cash patient, you were charging me $50 a visit. Now I got a job, I have insurance, I'm looking at, you're billing my insurance $300 a visit. I don't understand. What's going on here? Are you committing insurance fraud? Right? You never want patients to throw out the F word, the fraud word. That's why you have to have good, solid fee policies. You want patients to know exactly what your policies are. You know, let's say you bought a shirt in Macy's and you went to return it. And you said, okay, here's my shirt. I'm returning it. And Macy's rep says, we're not giving you any money back. You go, well, what's your refund policy? And Macy's says, we don't have one. But I could tell you, we're not giving you your money back. We don't have a policy. Now get out of the store. You know, that's not going to work, right? So when patients have questions about fees, you should have a policy on your fees. Some providers give discounts without advising patients their normal fees. Not okay. Patient education about medically necessary services versus wellness care is more important than ever. And here's a whole list. Take a look at your screen. Medically necessary, insurance payable. Wellness care, not insurance payable. Active treatment, payable. Pain, restricted motion, decrease ADLs, payable. Very little pain, range of motion, good. Patient could do normal, most of their ADLs, not payable. Performance enhancing care, I would have patients coming in. I don't really play golf that much, but I had a lot of golfers coming into my practice. And I was helping them hit the ball further. I would have patients coming in saying, Dr. Kotler, you're taking care of my friend Charlie. He's hitting the ball better. I want to hit the ball further. Come on in, Howard. I'll take care of you. Howard says, I just want to drive the ball further. I hit the ball 200 yards. I want to hit it 225 yards. Can you help me, Dr. Kotler? Yes. but that's not insurance payable. Staff needs to know that. Staff needs to know on the very first visit, new patient processing, deductibles, copays, coinsurance. There it is, described on your screen. You see, deductible, the amount paid by the patient prior to the insurance company paying. Coinsurance is typically out-of-network providers. It's a percentage. Copay, see there? Copay typically represents a flat fee. Copay applies to in-network providers. No waiving of copays, no waiving of coinsurance, especially if you're going to do a prepay plan. I hear this all the time. Doctor puts together a 30-visit prepay package. The doctor is in network. The patient has, let's say, a $30 copay. The doctor's putting together a package, having the patient prepay, giving a 20% off the full package. That means the doctor is waiving a portion of the copay on every visit. Can't do that. These are the 7 categories that we teach here at Target Coding that cover every single man, woman, and child that comes into your office. These 7 categories. The first one there, cash, is broken down into 4 subcategories: pay-as-you-go, discounts, prepays, hardship. So cash, patient, yeah, some patients, they just want to pay for each visit. Should you not? Listen, I'd rather the patient prepay, but if a patient says, I don't need any discounts, I understand your fee, I don't want to deal with insurance, I will pay every time I come in. Nothing wrong with that, right? I wouldn't kick a patient out of the office if they want to pay each time in full. Now you want to do a prompt pay discount, time of service discount, so there it is on your screen. Prompt pay is designed to reduce the cost of debt collection. About 15%. Not based on the patient's condition. Cannot advertise the discount. There's an opinion rule on that. Advisory opinion from the OIG number 0803. There's also information on the $75 rule. OIG says you can't give a patient more than $75 worth of free service for the whole year. So I know some doctors are advertising free exam, $150, normally $150. Come on in, no charge. Well, can't do that with a Medicare patient. Probably can't do it with regular patients either. So there's prepays. Yeah, prepays are great. Gets patients to come in, and they're the best patients. They've prepaid. Very rarely miss their appointments. Prepay patients I loved in my practice. The best cheerleaders. They didn't have to stop at the front desk because they've already prepaid. They show up for their appointments. Hardship, that's the next one you see on your screen. Hardship, yeah, some patients just can't afford it. It's okay. Sparingly to waive a copay or coinsurance or deductible if the patient has a hardship, or partially waive it. You know, if a patient comes into your office and says, I have no insurance at all. Absolutely no insurance. Now, we're talking about no insurance at all. I'm not talking about a patient that has insurance that just doesn't cover chiropractic, or patient has insurance for chiropractic but you're out of network and it doesn't cover out of network. I'm not talking about that. I'm talking about patients that have absolutely no insurance. In that case, you can give the patient free care. In network, got to follow all the rules. Copay, bill your normal fees. You have to accept their fee. Don't discount the copays. Out of network, there's more freedom. Deductibles, get past the deductibles, charge your normal fees. You could collect your normal fee. Let's say your normal fee is $100 a visit. You're out of network, you could have the patient pay you $100 at the time the service is rendered. You don't have any contractual obligation. Next is Medicare. Medicare, you have par and non-par. Chiropractors cannot opt out of Medicare. So that brand new patient coming in, careful. If you're not enrolled in the Medicare program, you should not be seeing the patient. Yes, let me repeat that. If you are not enrolled in the Medicare program and you have your active PTAN number, you should not be seeing Medicare patients at all. At all. Even for exams, even for x-rays, even for therapies. You should not be seeing patients. So make sure you know the difference between par and non-par, opting out, enrolling, not enrolling on that brand new visit. PI and work comp, well, that's based on the fee schedule in many states. Personal injury, you don't have to accept assignment. Most do. If you don't accept assignment on a PI patient, what's going to happen? especially if the patient has an attorney. What are they going to do? They're going to say, go to another chiropractor. Work comp, you cannot accept any money from the patient, but confirm that they have coverage. You have to follow the fee schedule. Then we have DMPOs, Chiro Health USA. Chiro Health USA has alleviated the stress of the dual fee schedule. That's always an issue with Chiro Health USA. Well, not with Chiro Health USA. They're the answer to the problem. The problem is I bill my insurance patients $180 a visit, and now a cash patient comes in and I only charge $40, and I do the same thing on both. Chiro Health USA, which is known as a discount medical plan organization, alleviates that whole conflict. And then you have patients that come in with health savings accounts, HSA, healthcare reimbursement accounts, see on your screen, flexible spending accounts. Give them a walkout receipt. Try not to give them codes. Okay, now, patients have rights, right? Hipaa rights. Patients have Hipaa rights. Inside of your Hipaa notice, you should explain to patients that if they want to, they could restrict how you disclose their information. Just the other day, Dr. Bornstein was in the news about violating Hipaa. Dr. Bornstein is a medical doctor in New York City, and he happens to have an unconventional patient. His patient is President Trump. And Dr. Bornstein decided to disclose to the New York Times last year that President is taking medication for hair growth. Whoa! HIPAA violation, absolutely. So now, if you're a patient and you want to have the office restrict how you disclose their information, for example, they don't want you to bill their insurance. Patients can come in and say, I want to pay you in full. I don't want you to bill my insurance. Here's the forms you would use, you see on your screen. Have good policies. This is our sample target coding financial policy. It explains to the patient that you have insurance, and insurance doesn't pay for everything, and you may be responsible for these services, and it outlines it. Target coding members, you have that form, right? Now, by the way, Target Coding, if you're not a member of Target Coding, you can buy our forms. If you're not a member of Target Coding, you could buy our books. You don't have to be a member in order to purchase our products. It's just if you're a member, you get everything. It's all bundled in. Have a good policy. I mentioned this earlier. Have a good billing and coding policy manual. It should be based on the 7 essentials you see on your screen. The 3 that I have highlighted, those are the ones you really have to focus on. Written policies and procedures, staff trainings, and conducting internal reviews. And here's a page out of our policy and procedure manual. Very detailed information. This is how we do our chart reviews. We have a spreadsheet and we score it. It's an open book test that the doctors score themselves. Sample training log, there it is on your screen. How about over-the-counter collections? You want your staff members to be collecting everything that you're owed. If a patient has a $30 copay and they forget, and now you have to send them a statement because they didn't show up, that costs you, the research has shown, it costs providers $10 to $15 to send out a statement. So if the patient owes $5 and you send out a statement, you've just lost $10 sending out a statement. So now some patients allow, some plans, in-network plans, will allow for a double copay. What am I talking about? You see it on your screen? Double copay. Some plans allow you to bill, or the patient is responsible to pay for a copay just for the exam, and they would be responsible to pay a copay for the adjustment. And also sell products at the front desk. Biofreeze orthotics, you see there's a list. Gift certificates for massage were one of my biggest sellers. Gift certificates for massage around Valentine's Day and Mother's Day. We sold tons of gift certificates right at the front desk. Patients didn't know that we provide gift certificates for massage therapy. Now here, I'm going to share with you. You see on your screen, this is a graphic. This is when a doctor looks out into the waiting room. This is what I would think of, and many doctors too. I know you could relate to this. You look out into the waiting room, you see 6 new patients. You see on your screen, Oh, there's patient number 1. She has headaches. See, I didn't even know many of my patients' names, but I knew their condition. I would see a patient in the supermarket and go, oh yeah, she has sciatica. Or I'd see, Joe at a maybe a sporting event. Oh, there's, and I didn't remember his name. Let's say, oh yeah, that guy's a patient of mine. He's got neck pain. I could tell. So you see on your screen, I see 6 patients. All I see are conditions: rotator cuff, sciatica, neck pain, knee bursitis, lumbar disc. Staff members, this is how you should be looking at the waiting room. Oh, there's patient number 1. I got to get a $50 copay from her. Oh, there's patient number 2. I need to get pre-authorization. Oh, patient number 3 has a balance of $240. Patient number 4, I got to get an ABN signed. Patient number 5, we ran her card. Credit card declined. We got to get an updated credit card. Patient number 6, insurance company's waiting for the notes. Staff, you have to be the pit bull. You're at the front desk. Now, I do have some offices I work with where the doctor's all alone, no staff. The doctor has to be the pit bull in the waiting room and do all this work. But most of you have staff. They should be assisting you. You want to maximize reimbursement, and you want to have a plan. You want to have an organized, systemized plan. A patient comes in based on what they have. Is it cash? Is it insurance? Is it PI? Is it work comp? Is it insurance? In-network or out-of-network? You should have your plan in advance. As soon as they tell you how it's going to be paid, you should go into that protocol. So just a few closing comments. Check with all the carriers you bill prior to submitting claims based on this information. Can't guarantee that this information will guarantee payment from any insurance company or patient. I want to thank everybody for attending. There's my contact information you see on your screen. You can email me directly right there, Dr. Kotler at targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. We have a HIPAA secure fax number. You want to fax us patient information? No problem. We got it handled. Everything's secure. You want to email us patient information? We have a HIPAA secure portal. Everything's protected, encrypted. So our HIPAA secure fax number is 1-844-831-2347. Now, besides these webinars, we also do seminars. We have videos that we sell a la carte. We do on-site consulting. We have membership programs. You could hire us for even as little as an hour. We do hourly consulting. We sell forms, letters, templates. We have a whole forms package. We implement HIPAA compliance programs, Medicare compliance programs. So we're going to get to questions and answers now. But first, I'm just going to say goodbye to our Facebook friends. I hope you enjoyed this presentation, and we'll be doing another one soon.